highlights and information about the global primary healthcare support that the institute will be providing. So this global primary healthcare support is one of the thematic area or working areas that the institute is working for, along with other 3 thematic areas. So the major objective will be enhancing the primary healthcare systems of low and middle income countries. So under these initiatives, we'll be providing or developing capacity building programs and provide training programs and establish and provide virtual training program like this, and also with a blended modality, and conducting primary healthcare capacity assessments for selected countries so that we could have an understanding of their health systems, and we could support, or they could also work on their needs and gaps accordingly. And also we have a technical assistance team established here in country and international teams, and those teams members are also be providing technical assistances to those countries who are needing or want to have those technical supports to implement the programs. Okay, so these are just to summarize the support areas that the institute is providing. This support is categorized in 3 ways. So we call it 3 buckets modalities that we are providing. The first one is we provide capacity building trainings that is aligned with site visits in Ethiopia, like these programs. So this once the training is provided either in face-to-face or in a virtual way that we did for this course, then once it is completed, site visits will be prepared and arranged so that participants will get a full picture of the systems in Ethiopia and other countries as well. So this trainings will be based on the need of the countries, or we could have such prepared capacity building programs as well. So the packet 2 will be containing the trainings, site visits, and also following up of after training. So we don't leave anyone once we provide a training, we didn't leave them. So rather we'll be following up or mentoring how their progress is after taking those courses or those training programs or field visits. And finally, on bucket 3, it might have training programs, site visits, but also have if the countries are required to have a design of implementation or strategies to improve their primary healthcare system, will be supporting using those technical assistance team that I've been mentioning on the previous slides, and will be also providing both on-site on the specific country site, and also virtual supports based on the need and demand. So as Dr. Frey mentioned earlier, we have been providing this training, these capacity building programs in different areas and topic areas that will be supporting the country's health system and primary healthcare system specifically as well. So more than 17 countries have been taking this course from the Ministry of Health or program implementers, and also sometimes partners as well. So we have get very positive feedbacks, and also we have some improvement feedbacks. Based on that, we improve our courses day to day or going through. And so now we are revised our materials and prepared in a blended format, so that that could be fitted to the everyone everywhere, so that without detaching with their working places, they could take these courses, and only for the field visits they could be coming. But still, we'll have a face-to-face option as well. If anyone who is willing or want to come to Ethiopia and take this course, we could also offer those options. So after this, major lead is going to be talking by Dr. Micah about courses and contents. So I'll be handed over to Dr. Micah. Over to you, Dr. Micah.
Thank you so much, Tersit. Greetings, everyone. It's really exciting to see all of the introductions in the chat, and to be finally at this point of relaunching the newest version of this course. So this has been an incredible team effort, collaborating with the team at the International Institute for Primary Healthcare in Ethiopia, and we're so excited to have all of you as part of this pilot experience, and really looking forward to your feedback and suggestions and engagement over the next few weeks and months, and hopefully beyond. So this course is really coming out of the vision for primary healthcare from the Declaration of Alma-Ata, and also really drawing on Ethiopia's extensive experiences and success in primary healthcare. And also we're really excited as we continue to look forward to bringing in other examples for how primary healthcare is being built and sustained and evolved across the region. So really looking forward to hearing about your experiences and your questions through the course platform and the upcoming field visits as well. So we'll hear more about that towards the end of the presentation. So this course is really designed for health systems leaders who are working on or planning to work on or develop and lead primary healthcare programs, and also the policies that support them, either at country level or for other specific populations. The course is focused for the African region, and really also brings in other public sector leaders and managers, and the range of development partners that are supporting the public sector for primary healthcare. So the objectives for the course as a whole are to really be for learners to be able to explain the core principles of primary healthcare, also to explore the structure and the functioning of the health extension program in Ethiopia by looking across the WHO health systems building blocks, which I'm sure are very familiar to all of you. And then we've also included a module on community engagement, given how central that relationship and connection with communities is for successful primary healthcare systems. We're also aiming for learners to be able to assess how the experiences from the health extension program in Ethiopia can be adapted to other contexts, and then to be able to come out of this course with an action plan to apply that information and explore the opportunities in your own country contexts. So the course is divided into 8 modules. The first 4, which we'll look at next, are the ones that are the required modules for this pilot. The other 4 are currently electives. So you'll have an opportunity to explore them, but we know that it is a lot of content, and so we're trying to provide some focus and also give you all flexibility to explore what's most valuable to you. Within each of the modules, there will be both opportunities for sort of engagement and reflection, quiz questions, and also some other homework assignments. There are also a range of readings. Some of them are required, and then there are also some additional resources for those of you who would like to have some more information on a particular topic area. Then there's the sort of running country plan, which will be that final sort of takeaway from the course. What can you work on next in your own context? And then finally, there's the field visit component, which Tersit will be talking more about at the end of this set of slides as well. So we'll go through the 4 required modules for the course first, and you'll see them in green. So the first module is an introduction to primary healthcare. So you'll see some of the background about where primary healthcare came from, what are the vision for primary healthcare, what are some of the key sort of provisions or components of PHC. Then we'll look at sort of an overview of what primary healthcare is, what the health system's building blocks are, so that you can envision what you'll see it through the rest of the course. And then an introduction to how primary healthcare is organized and managed in Ethiopia in particular, so that you have a little bit of that background about the structure, the functions, and how it all fits together. The second module is on service delivery, so we'll look at some characteristics of good service delivery and some best practices, essential packages of health services, the primary healthcare delivery modules, an overview on health equity and how we ensure access to services, and then an overview of how health service delivery is done for PHC in Ethiopia. The third module is on human resources for health. So you'll see some basic health workforce structures and an overview of sort of the life cycle of the workforce, starting from entry and how to prepare the workforce, enhancing the performance of the current workforce, and then managing sort of exit and migration and attrition and other ways that the workforce, the workers within the workforce may leave or take on new roles within the workforce structure. And then also an overview of the workforce for primary healthcare in Ethiopia. The last of the required modules, which is module 4, so we can go to the next slide, is a module on leadership and governance. So this is a module we're really excited about. We know how important this is for primary healthcare and really looking forward to your perspectives and additional suggestions for this module. So there's an overview on leadership and governance for primary healthcare, and then delving deeply into leadership and governance structures in Ethiopia's system. Then the other 4 modules are the elective modules. So we're also really excited for you all to explore these. Hopefully some of them will be sort of in your wheelhouse for the work you're doing in primary healthcare as well. And we're excited to have them as part of the course also. So the first one of these is the health information systems. So you'll learn about components of HIS, health information systems for PHC in particular, some of the mechanisms and structures for reporting and feedback, both sort of reporting up information to higher levels of the health system, as well as for some of that feedback loop in order to ensure that both frontline workers as well as communities have information that's relevant and useful for their work. And then looking specifically about how health information systems are managed in Ethiopia for PHC. Module 6 is on procurement, supply, and management of commodities and essential medicines. So we'll talk about what essential medicines are, mechanisms for procurement and supply management, how we ensure drug quality and safety, a little bit on financing, which also overlaps a bit with the financing module, and then specifically looking at how supply chain is managed for PHC in Ethiopia as well. The 7th module is on financing, so you'll see some core principles about health financing and how it functions, specifically community health financing for PHC, and then looking at how financing is set up to support the primary healthcare system in Ethiopia. So those modules cover the WHO building blocks, and then as I mentioned at the beginning, we've added a module specifically on community engagement and communities. So in this module, we'll cover how community health systems are defined, how we foster community engagement and participation, a little bit on measurement and metrics for community engagement, and then looking at how communities are engaged and how they're supported through the primary healthcare system in Ethiopia as well. So for each of these modules, you'll have an introduction, some learning objectives. There will be basic content that's provided that includes a lot of sort of best practices from WHO and other sort of global organizations. And then also an opportunity for self-reflection, both sort of knowledge checking as well as being able to capture some takeaways for yourself. You'll have an opportunity to look at country case examples, but also to share examples and tools and perspectives from your own work. And then there will be a review at the end of the module, which includes sort of some prompts to think about your country plan and what to take away from this module into your own work. So that's a bit of an overview about what to expect. I'm going to now hand back to Tersit to talk a little bit about the requirements for completing the course and preparing for field visits to Ethiopia as well. So back over to you, Tersit.
Thank you, Dr. Micah. So yeah, I think you have seen the 8 modules and the structure of the modules, how they are organized. So once you have completed those modules, yeah, you will be getting a certificate of completion from this course at the end. So for that, it has some requirements. So we have a pre-course activities that we have been released or opened starting from February 28th. So you have to, yeah, everyone taking the course needs to submit that pre-course activity and complete 100% of the required learning activities that is embedded on each modules of the content. Like there are different reflection questions in each modules, and it has also a quizzes at the end of each module. So and session as well. At some pointers, so you should, or all participants need to complete those required learning activities stated on the modules. Then we'll be having a final quiz as well, so that is also must be completed, and you all have to have a pass result after the quizzes. And we have prepared 4 badges that maybe Brooke will be explained about this after these 2 slides. So the required modules, as Dr. Micah mentioned, is first 4 modules that's going to be released on the next 4 weeks that you'll be completing. So for each modules, there will be a badge. So you need to earn those badges to get a certificate of completion and develop and present a country plan. So we expect from everyone. Actually, it's going to be a group. It might be a group assignment or a group requirement, so that you could prepare a country plan based on the learning objectives that we have seen on the modules. And then we also be required to get a feedback about the course or for the course, so that we could improve for the pace for the future. So we should, or all participants need to complete these 6 points to get a certificate of completion at the end of 4 weeks after this. So these are certification requirements. Then the next requirement will be for the field visits. So now we'll be having participants from 5 countries. So not the engagement and other things will be different from participants to participants. So we need everyone to be engaged and participated through all this course implementation process. So to then at the end of the day, once gets certifications and completing the course, we have a plan to bring the participants and take show the real situations or to get a real experience of the country primary healthcare system. So for this, we have a set of criteria. So we need to we need to get a participant in an organized manner in a country basis. So for those countries who will be coming in a country representation, and also be certification from the online course, that is for the 4 modules, will be one requirement, and able to develop a country plan. This is very critical. So this course is not just giving a knowledge or experience for individuals, but rather we need to have the participants to contribute to their countries or take those experiences to their countries' health system, so that they could contribute to changing the system or a facility or an organizations in their country. So we expect the participants to have a country plan as a group of country, and at least attend 50% of the live session. We'll be having 2 live sessions that are required, or is prepared to summarize the modules. So on those live sessions, experts will be available. Then they could brief major informations in international experiences and country experiences. On those live sessions, you will get a chance to ask questions, get experience from different countries along with the team. So it is a great opportunity and also be a learning way to get an experience. So at least 50% of the live sessions should be attended. And we also expect a support letter from your country Ministry of Health. That means that is one assurance that you will be, after taking or completing this course, you will be getting back to your country and make or try some efforts to make changes on the country system, as long as you get some helpful information and experiences from the course. So to get a field visit or to attend the field visit experience of the Ethiopia primary healthcare system, these criteria or requirements must be met by the participant. So yeah, these are the requirements. Maybe if you have any questions or suggestions or anything that you would like to raise, you could raise it once Bru have completed how you're going through the course platform. So I will be giving a podium for Bru. Over to you, Bru. Thank you.
Thank you, Tersit. Thank you, Brian, for joining us today. It's a pleasure to have you all. So I think I can start my session with one poll, so that we can know where are you joining us today. So select your countries, please. Okay, so my name is Bru, and I'm an online training manager of the Institute. I will be sending an emails to you, and we have been communicating through emails offline. So are you done selecting your countries? No. So only 23 participants have selected their countries, and we'll see the results when you are done. So when I come to my presentation, I want to show you how you can easily navigate on the platform and how you can easily complete the learning activities that are available on the platform, so that you can earn your certificate of completion, and you can also take the knowledge, skills, and attitudes that are incorporated in this lessons. So this is our learning management system. it says elearning.iphce.org, and this will be sending to your email. I have been sending a couple of emails in the past 1 week. So using the credentials that we have sent you, you can alternatively use your username or email address here in the field username. So you can use your username, or you can use your email address to log in. And if by any means your username or email is not working or letting you into the platform, please let me know, and we can easily resolve that. And in case after you reset your password, the password that we have sent as a default, which is 4321, and if you lost your password after you change it, you can use this forget password icon to get a link to reset your password, or otherwise easily you can email me and I can reset the password for you so that you can have another new email. So initially, when you log into the platform, it will directly take you to the site homepage, and you will find the courses that you are enrolled in. So before going to the course, let me show you one thing. So you can come here in the right upper corner where you can find your name and your profile details. So if we have mistakenly make errors in typing your name, setting your time zone or something like that, you can click here and edit your profile by clicking on the profile section. So you can edit your profile. For example, we may have missed your title or something like that, so that you can add here, and that will be the name that will be displayed in your certificate. And you can also update your profile picture, your contact addresses, something like that. So you can customize your profile so that people can easily find you, and also you can have appropriate naming on the certificates and the forum and something like that. So here, as you may have seen, there is home and there is dashboard. So if you want to explore another more courses, dashboard have like recently access to course. So you will have mainly one course for now, which is a global PHC curriculum. And actually there is also another one course, which is leveraging primary healthcare systems for COVID-19, which is a self-paced open course. You can enroll yourself there and also you can take that course. But let me dive into the global primary health care course, which you are currently taking. So when you open this course, you will see the progress, your overall progress here as a percentage, so that you can track which activities are left and which activities are completed. Here we try to put some information about the course and how the course will be delivered. And here we try to put the calendar for the course, which can be integrated to your calendar. So please add this calendar to your Google Calendar or Outlook, something like that, so that you will not miss anything about the course. So by clicking here, you can integrate or add this course calendar to your Google Calendar, or by downloading this ICS calendar file here, you can integrate the course calendar to your calendar on Outlook. So you can get information on when the modules will be released, when the activities deadline will be there, and any other additional information on the course schedule can be found on this calendar. And also, in case of any technical difficulties, any concern or questions, please contact me using this email address. So as it has been said, this course have 4 mandatory modules, and the others are elective, in which you can take based on your preferences. So now only module 0 is open, and as you may have seen on the course calendar, as I can go for the next week, on Monday we will be releasing 2 modules, as you may see here, module 2, sorry, I think I'm on 28, right? So I was also here. So Monday on March 14, module 1 and module 2 materials will go live, and so that means by Monday, module 1 and module 2 will be active for you, which are restricted now. And when you hover your mic on the restricted icon, you will see when the restricted items will be available for you, as you may have noticed from here. So you can easily navigate on the course like this, and you know, we have set completion activities, different completion activities for different activities. So for example, for this video, when you see the video, it will be automatically checked for you as a complete, so that as you may see in here, it will be like ticked with a green bubble here. And here, for example, in the self-introduction and setting expectations session, when you reply or when you post one post or when you reply one reply, it will be automatically checked for you. And when you come to activities like an assignment which requires a submission, for example, you can see here the pre-course assignment. So there is a template here you can download. If you click on this, it will be directly downloaded for you, so that you can open it and do your assignment, and then finally you can come here to add a submission. And when you submit your assignment, it will mark it complete for you. And finally, we have also added a checklist for you, so that you can track if you have completed the required activities on the modules. There can be some optional activities in the module. For example, in the main modules, that means in module 1, 2, 3, 4, you will get some discussion activities that are in which participations are optional, and that will be clearly indicated for you. And I think the course platform is relatively easy to navigate, but please feel free to reach me at any point when you face any difficulties. So just drop me an email, and I will reply instantly for you. Thank you. So when you complete the required activities for each module, you will be receiving a badge acknowledging that you have completed, for example, the service delivery in PHC, the human resource for health in PHC, the leadership and governance in PHC, or something like that. So that you'll have like an acknowledgement for every module you are completing. And finally, when you complete all the 4 modules, and when you have all the 4 badges, you will receive a certificate of completion automatically. And the other thing I want to show you is the main contents in each module, which are the score packets. So they open like as you see here. So they may be taking a moment, like some seconds to load. So don't worry, they will load, and they work pretty fine in mobile devices too, but we recommend doing it on a computer when it's possible for you. But don't worry, they will definitely work smoothly on your mobile devices too. So what you always need to do is clicking on the Start Course button to navigate through the main content, but alternatively, you can also click on the details, which takes you to some details. So that in this module, you'll explore this or something like that, and what you should have been doing. And also you can see the course structure or outline. So then you'll come back here and click on the Start Course button so that you can dive through the main content. So these are interactive contents. We use like these italic fonts to put instructions. So whenever you see italic font on the main course, please read them because they have some instructions on how to navigate that specific material. For example, here it says flip the cards below for download links and some details. So working together for health document is here. When you click on it, it will have something embedded there. So by clicking like this, you will see something. Here there is an interactive exercise in which you are invited to select all that apply for this question. So you can click on these buttons and see if you are right or wrong by submitting it or something like that. So then you can also navigate to the sessions. You can click here to see the structure, the course structure here. If they are locked, you will not be allowed to pass course structures or sessions, but sometimes there can be also a chance to navigate through this. And when you want to return back to the learning management system from this SCORM package, you can always click on this exit course button. It will take you back and your progress will be saved. So you don't necessarily required to finish one session at a time. So if I exit this course and so it says it like this, and if I go back and come to this course another time, it will resume where I stops. So don't worry, you can learn or you can complete this session as per your pace. So as you may have understood from the earlier presentation, this course content has many self-paced contents. Majority of the contents will be provided to you by these self-paced materials so that you can learn based on your preferred time, preferred place, and the like. So only 2 live sessions will be there in this course. So you are highly encouraged to use those sessions to ask questions, to share your experiences, and to interact live with experts in the area. Otherwise, those sessions will also be recorded and shared with you as well. This is my presentation in short. I am okay to answer any questions that you may have, and I'm always here to provide support for you. Thank you. And I will be sharing the result for the polls. Thank you. Over to you.
Thank you, Bru. If there's anything that the team wants to add, let me give the opportunity. Otherwise, we can open the floor for participants to ask questions. So, Tersit, do you have anything to add?
Not from my end. I will respond if there is any questions. Thank you.
Okay. Thank you, everyone. So now the floor is open. If you can raise your hand, I can see if you have any questions. So yeah, please feel free. We want this session to be as interactive as possible, so feel free to say a few words, even if it's not questions. Yeah, so the floor is open. No questions. You can also put your questions in the chat box in case you have, a poor connection and things like that. So feel free to just put your questions in the chat box. In addition, the team here is very responsive and active, so they will respond to your questions either regarding the course or the learning platform. So you can directly contact Buru or Tersit or Micah, myself, if you have anything that you want to flag or share with us. So yeah. Oh, okay. So are we going to, are we able to share the slides from today? And are we going to be able to download the modules as well? Bro.
Yeah, thank you. So I think we can share the slides from today's session. And regarding the modules, there are downloadable materials on the course, which are additional reading materials from different sources, and also participant guides or manuals that were prepared by our institute will be there for you to download, but the SCORM packages are not downloadable. They are actually downloadable. That means can be used offline on Moodle app. If you download the Moodle app and log in with the credentials from us, but the nature of the files will not run without LMS, and you will not be allowed to download them to open with another third-party application. So that's it, but you will have a guide.
Okay, great. So we have a couple of other questions. My apologies if I mispronounce your name. We have a question from Bidur Kamal asking if there are a deadline for each assignment, or is it until we open at the end of each module? And the other question is from iWindy saying that there's someone who missed today's session. Are they able to proceed with the training even if they missed today's live session? Yeah, so thank you. Over to you, Bruch or Tersit, to reflect back on those questions.
Okay.
Dr. Frey?
Yeah.
Proceed, Tersit.
Okay. Yeah, thank you. I think that's important questions. Maybe regarding with the live sessions, as the colleagues missed today's session. I think for today it's fine. We understand because some of the participants still didn't join and start the platform and the core access the course, so we can understand. So they could proceed with the training and also after starting the course and the modules, as I tried to mention on the earlier presentation, we'll be having 2 live sessions for the modules specifically. Yeah, even if they didn't complete all the live sessions, all the 2 live sessions, they may be getting a certificate on completion as long as they complete other activities and required activities. But for the field visit, at least they need to attend one of the 2 live sessions from the 2 live sessions that is prepared directly for the modules. So because those live sessions are very critical, but for now we could share the recording of this session, I think, and they could proceed with training. And maybe regarding with the deadline, I think one of the assignments that we'll be having is the pre-course activity that we were expecting for the parties to complete it by tomorrow, because they are going to be, the modules will be opening on March 14th. So there were some backend forces with some technical issues and in accessing to the platform and the modules as well. So considering that, it was supposed to be the deadline will be tomorrow, but we could understand and accommodate that for this case because it is just we were just launching the course, but we will put postponed deadline for the assignments, and but based on those deadlines, I think they need to complete and submit the assignments. So maybe if Bruce want to add on this, I could. Yeah, thank you.
Yeah, before that, Tersit, can you say a few words about the country plans? There was a question about requesting details about the country plan from Tagawa. So
yeah, the country plan is after completing, we'll be sharing. We have a country plan guide for the participants, how they could prepare it and submit the country plan, and also there will be a presentation. So this is expected once they complete the modules. So, but through all the modules, they will be taking the note, some best experiences that they would take to their countries, and also make changes or contribute or do some efforts, so they could take the notice. But at the end of the modules or the course, before completing everything, they will pick those best experiences they would like to take to their countries and put a plan. So there is a detailed plan, a country plan guide that we are going to share and also be present if it's necessary, if there is any unclear things, and we'll clarify how they could do it in details. But we didn't bring it here because it might take some time, and it will be good also to present or describe it after they took or started the modules. Yeah.
Okay, thank you, Tersit. Anything to add from Bruce? And we really appreciate your questions in the chat box, but we also want to hear your voice. So if you have any question, please feel free to raise your hand. Yeah, and that will be an icebreaker as well. Brooke, Micah, do you have anything to add?
So I just want to emphasize some point on the country plan, and this course is not like open for all the type of course, because we want to target individuals that can impact or like that can contribute on the improvement of primary healthcare services on their country. So, especially coming in group from one country can help you to identify some aspects of the primary healthcare that can be modified from the concepts and knowledge skills that or best experience that you get from this course. So in this course, we have many practical best experiences that are adapted from different countries, including Ethiopia. And we believe that you will have some important points that can really impact your primary health care, that can really improve some aspects of your primary health care in terms of service delivery, in terms of leadership, in terms of human resource, or in terms of general framework of your primary health care system. So I think you need to strengthen your team as a country team, and working as a group on those points, discussing on those points will be very good. We'll be also creating these groups on the Moodle platform, the LMS, so that you can have a place to discuss as a group, to put points as a group, and also to make submissions as a group. So I just want to add that. And I saw one question about the poll that may be a clarity question. So I shared a poll just to ask, where are you joining us today? So that was the poll I was mentioning about. Thank you.
Thank you, Bruce, for further clarifying that. And it was very pleasing to see participants joining from different countries. So hopefully in the coming sessions, we will have the opportunity to hear more from your end, because we're going to have this other live sessions, which are going to be more technical than the introduction, where we expect our participants to actually share their perspective, their country experience, and how they think such strategies can be implemented in their context. So for today, I think we're almost getting to the top of the hour, which we're about to finalize our live session. But before we do that, let me give the opportunity for Micah to say a few things if you have anything to add.
Thank you, Dr. Freyot, and thank you to the whole team for laying this out, and to all of the participants for some great questions. We do really are excited to hear from you. So please do reach out to us if you have questions about the course, if you have other things that you're interested in to know more about the Institute, or if you're looking for something specifically around PHC that might be able to support your work. We'd really, really love to hear from you. So please feel free to reach out via the Moodle platform or directly by email. We would really love to get to know you better and understand the work you're doing, and how this course and potentially other future opportunities can best support you. So thanks again to the Institute team, and thank you to everyone for joining us today. And we really do look forward to talking more with you over the next few weeks and months. So yeah, thank you all, and back to you, Freyot.
Thank you, Micah. Thank you, everyone, for joining today's live session. We really look forward to continuing, to interact with you. The team here, as I have said, very supportive, and will be responding to all of your questions and inquiries. We also would like to thank the John Hopkins Bloomberg School of Public Health for collaborating and supporting us in this, training initiative. So thank you, everyone. Have a wonderful day, morning, afternoon. Bye.
Thank
Bye-bye.
you. Bye.
Bye.
Bye. Thank you.
Bye. Thank you.
Bye.
Bye-bye.
Bye. Thank you.
Thank you.
Thank you.